Welcome to the COOP for Rural Hospitals webinar series. This is webinar 4, Vital Records, IT, Human Resources, and Communications. In this webinar, we will review the COOP planning elements related to essential records, staffing, and communications.
Before we begin our webinar, let's review the components of the Rural Hospital COOP Toolkit. While this toolkit was designed specifically for rural hospitals, other hospitals or other healthcare organizations may find benefit from the elements in the toolkit. This toolkit has been specifically designed for rural hospitals and includes 6 components, which you see listed on the graphic on the screen. The first component is a COOP plan completion guide, and the second component is a COOP plan template. These are designed to work together to help hospitals customize their COOP plan. The third component is a COOP tabletop exercise in a box that includes all the materials you would need to design and conduct a tabletop exercise at your hospital. The fourth component is a collection of resources related to COOP planning, specifically COOP planning industry standards and best practices. This curated list of resources may be helpful as you write or update your hospital's COOP plan. The fifth component is a frequently asked questions document to help you explain COOP planning to your peers and executive leaders. The sixth and final component of this toolkit is this series of webinars to help continuity planners complete or update their hospital's COOP plan. The webinars are focused on the first 2 components of the toolkit, the COOP completion guide and the COOP plan template. The completion guide has been designed with activities and explanations of how to write a COOP plan for your organization. As you complete the activities, you can move answers into the COOP template. The template can be edited or adjusted however you see fit to meet the needs of your organization. If you already have a COOP plan, you can use the completion guide to help augment or revise your current COOP plan.
And now for webinar 4, Vital Records, IT, Human Resources, and Communications. In this webinar, we will focus on the COOP planning elements related to essential records, staffing, and communications.
This is a roadmap graphic that describes the 4 phases of COOP planning, and each phase corresponds to a bend in the road. There is a red chess piece that will move with us as we progress through this roadmap and progress through the webinars. Step 1 in the COOP planning process is to prepare. Preparing includes building your COOP planning team and setting up your project management plan, as well as understanding the COOP planning elements and the regulatory environment. Webinars 1 and 2 focus on step 1. Step 2 in the COOP planning process is to write your COOP plan. Webinars 3, 4, and 5 guide you through writing your COOP plan and using the COOP completion guide and the COOP planning template provided in the toolkit. Step 3 is to train and exercise so your staff know how to activate the COOP when needed. This will be covered in webinar 6. And finally, step number 4 is to evaluate and improve your COOP plan. This will also be covered in webinar 6. We will refer to this roadmap graphic and the 4 steps of COOP throughout this webinar series.
Here we see our roadmap again, and our red chess piece has moved to step 2, to COOP. In this webinar, we will focus on identifying an organization's COOP vital records, IT, human resources, and communications planning elements. We will build on what we discussed in webinar 1 and 2. And again, please have the COOP completion guide, COOP plan template, and your current COOP plan, if you have one, available. If you want to follow along in real time, you can pause this webinar at any time. The first COOP planning element to review is vital records. The goal of identifying vital records is to develop and maintain an essential records packet for each essential function so that when a continuity incident occurs, the guidance documents and forms needed to assure essential functions are immediately available. Vital records may be an electronic or a hard copy document. Review the essential functions and consider which vital records would be necessary to support essential functions and/or supporting essential activities. There is an essential records packet identification table in your COOP plan template where results can be documented. We will continue to use food services as our example. Some potential examples of vital records for food services are temperature logs for both food and equipment, patient dietary cards, vendor contact lists, equipment manuals, and recipes. The next COOP planning element to review is information technology, IT. As an organization works towards achieving continuity planning, the primary considerations for successful completion mean the following have been planned for: identification, protection, and availability of information systems and applications, electronic and hard copy documents, references, and records needed to support essential functions. Without access to databases and/or IT systems, a facility is at risk for negative outcome events and significant impact to patient care and outcomes. An organization may have an established information technology disaster recovery (ITDR) plan, and it is recommended to review this plan prior to beginning the COOP planning process. This is where having someone from the IT department on the COOP planning team will be important to ensure the COOP and ITDR plan align. Finally, it is recommended to review the essential functions and consider which information technology systems would be necessary to support an essential function and/or supporting essential activities. There is an essential information technology identification table in your COOP plan template where results can be documented. We will continue to use food services as our example. Some potential examples of information systems and applications for food services are an electronic medical record, food ordering software, equipment ordering software, and the staff scheduling system. The next COOP planning element to review is human resources, which includes determining orders of succession and delegation of authority to ensure availability of decision makers who have the approval to make operational and/or financial decisions in the event the primary leader is not available or incapacitated. Orders of succession ensures a plan is in place for the assumption of senior level positions during an emergency if any of those personnel are unavailable to execute their legal duties. An example would be a director, then an assistant director, and finally an associate director. When planning for orders of succession, it is recommended to collect by title, not name. If possible, attempt 3D planning for all positions which directly support essential functions. And finally, look across the organization as well as up and down. Orders of succession should take into account experience, capability, and credentialing. There is a delegation of authority by orders of succession table in the COOP plan template where results can be documented. We will continue to use food services as our example. An example of orders of succession planning for food services may be the director as the primary, the assistant director as the secondary, and the associate director as the tertiary. If a facility does not have this depth of leadership in their food services department, consider frontline leads, such as a chef, to support in a secondary or tertiary capacity. Once orders of succession have been identified, it's important to define what the delegation of authority is. Delegation of authority allows a facility and/or department to predetermine what is or is not appropriate decision-making for someone who is operating outside of their normal scope of work. This can be thought of in two categories. The first being administrative authority, which involves decisions related to normal operations, and the second being emergency authority, which involves decisions to implement or activate emergency actions, such as evacuation, relocation, and personnel recall. When developing delegation of authority planning and boundaries, consider the following and identify if and when someone has the authority for these activities to act on behalf of key leadership. Can they hire or fire? Can they sign contracts? Can they make financial decisions? Can they create policy? And finally, any additional legal considerations. Define the type of authority and add the definition and parameters for each type of authority by essential function. As noted in the previous slide, there is a delegation of authority by orders of succession table in the COOP plan template where these results can be documented. We will continue to use food services as our example. An example of delegation of authority for food services may be the assistant director as a secondary has administrative authority to complete food and supply orders and schedule staff. For the associate director as the tertiary, they may only have emergency authority to recall staff and approve overtime. Remember, the objective of delegating authority is to give staff guardrails for decision making when they are operating in a position they are not typically assigned. Finally, an organization's essential functions are related to and impacted by the availability of staff members. It is vital to identify by essential function the type of staff members necessary, how many will be needed, and the typical shift worked. Planning for continuity of staffing should focus on the minimum requirements to perform and maintain essential functions. Consider the time of day, week, month, or season, and if these factors would impact an organization's staffing COOP plan. Try to plan for the average staffing need of the organization, and consider average daily patient census if staffing is too difficult to gauge. Some considerations when planning for COOP staffing include what a reduction of workforce would look like and under what conditions that would occur. If and when a telework policy would be implemented, focusing on which departments have the capacity to operate remotely while supporting essential functions. And finally, reviewing or developing policies to address overtime, leave with pay, leave without pay, flexible leave options, vacation time, and sick time. Review the essential functions and supporting essential activities and identify their minimum staffing requirements by essential function. There is a continuity staffing matrix table in your COOP plan template where results can be documented. We will continue to use food services as our example. In Webinar 3, we identified preparing food as an essential function of food services. An example of minimum staffing for this food services essential function would be 1 cook, 1 prep cook, 1 server, 1 dishwasher, and 1 registered dietitian. The last COOP planning element that will be covered in this webinar is communications. The primary objective of planning for continuity of communications is to ensure full connectivity among leadership, internal elements, and other organizational entities to perform essential functions during a continuity incident. Continuity of communications must account for notification and activation criteria. Be sure to include information on specific communication systems, management processes, and/or notification/coordination strategies for a continuity incident. Equally important is considering how external communications will occur within the community the organization serves and how vendors will be communicated with. The process for notifying internal and external stakeholder groups, along with who is responsible for performing these notifications, needs to be documented in the COOP plan. Review the activation and notification sections in the COOP plan template. Update the language to reflect the facility's specific information and/or reference the activation process from the EOP. We will continue to use food services as our example. An example of continuity of communication may already be documented in the organization's EOP. Be sure to review the EOP before developing a standalone continuity of communications section. Department-specific information may need to be recorded. Examples of these may be a staff contact list or a call tree. That brings us to the end of Webinar 4, Vital Records, IT, Human Resources, and Communications. In the next webinar, we continue with Step 2, and look at facilities, devolution, and reconstitution for our identified essential functions.
This webinar was prepared and recorded by All Clear Emergency Management Group under contract with the Minnesota Department of Health Emergency Preparedness and Response Division. If you have any questions, please see their website at www.health.state.mn.us/about/org/EPR.